In this episode of the Healthy Chit Chat, we're going to be discussing thyroid nodules. Thyroid nodules are very common. About 30 to 50% of the adult population can have thyroid nodules. So first of all, what are thyroid nodules? So thyroid nodules are typically found on thyroid imaging. And if one part of the thyroid gland can be demarcated and said to look a little bit different from another part of the thyroid gland, we typically call that by definition a thyroid nodule. Now thyroid nodules can also be palpable, which means you might be able to feel them. Typically they're felt by other people rather than by yourself. So for example, a healthcare provider examining your neck. And thyroid nodules, if they're large enough, might also be visible, where you see a bulge coming out of your neck. So why do we care? Well, thyroid nodules are typically benign, meaning they're harmless. But in about 5 to 10% of cases, they can become cancerous at some point. Now, other problems that can happen with thyroid nodules is if they grow large enough, or depending on their location, they might affect your ability to speak, they might affect your voice, they might affect your ability to breathe, and they might affect your ability to swallow. Now, in terms of figuring out if the thyroid nodules are cancerous or not, the best test is to do a thyroid biopsy, which entails putting a little needle in the thyroid gland, taking some cells out, and those cells are examined under a microscope, typically by a pathologist, who determines if there are features to suggest thyroid cancer. And if there are features that suggest thyroid cancer, typically the treatment is surgery to remove either half the gland or the entire gland.